Okay, so this is Luke Pritchard again at Dani K Gym. We're doing another video. Today we're with Angie. How you doing, Angie?
Good, how are you?
Good. What are you here for today?
Well, I have some back pain that I've had since having 4 kids and epidurals.
Gotcha.
And I have a little pain in my shoulder. It
Okay.
tends to act up a lot when I'm running and
Okay.
any kind of like motion. Yeah.
So it's mostly in the back?
Yes.
Okay.
Just this one, not this one.
Okay, so left shoulder. So today we'll do a back treatment and a shoulder treatment. We're also going to treat some other stuff. Do you mind if I see your tongue? Okay, so it has a red tip. It's a little bit short and it's a little bit shaky. Thank you. So there's some emotional stuff going on. Are you having trouble sleeping at all?
I've always had trouble sleeping.
You've always had trouble
yeah.
sleeping. Okay, so we're going to treat that too. And then, do you mind if we talk about your cycle today? Or?
No, not at all.
Okay, how's that?
My cycle has always been very, very long, very heavy.
Okay, some cramping.
Lots of cramping.
Okay, so you're not having your cycle right now, correct?
Not right now. It
Okay.
should be coming very soon.
So we're going to treat your cycle ahead of time. So when your cycle comes around, you're not going to be experiencing all those symptoms, or you'll be experiencing them a lot less.
Okay.
Okay?
Yeah.
Okay, thank you. Okay, so now we're doing the treatment for Angie. I'm going to move this up a little bit. She's having low back pain, so I'm going to check out to see what her hips are doing. Okay, so this hip is moving anterior superior, it's moving up. This hip's moving posterior inferior. So we're going to do needles along this hip, and then for the low back and the PSIS joint. And then also a couple on the sacrum. And so what that's going to do is it's going to balance out the hips and it's going to take pressure off the lower back. I'm also going to go to the lower back region though too, because there's definitely some tension here. Earlier I felt some tension in her neck, mostly right in here, and certainly in the shoulders. So we're going to treat that too. So today we're going to start at the neck and then we're going to move down the body. So we're going to do GB20 for neck pain, or neck tension I should say. Okay, there's definitely some tension in there. I'm going to grab a different needle to make it a little bit easier on me. And make it easier on her. So this is a smaller gauge. It's going to go in a bit easier. There we go. Breaking through some scar tissue there. You doing okay, Angie?
Yeah.
Okay, good. Okay, so we're finishing up with the neck right now. Now we're going to move on to the shoulder. Do you have tension here? 1 or 2?
2.
2. Okay. So we're just doing some local points for tension, for pain. Do you feel it in the joint at all? Like over here?
No.
No? So it's mostly just the upper shoulder and the neck. Okay. There's also some vertebrae displacement, so we're going to work on the back up here too. with the vertebrae displacement, the vertebrae are moving into different areas. So there's some nerve impingement going on. And what I'm doing is I'm working on the muscles around the vertebrae. And what that's going to do when I release the muscles, it's going to release a nerve, and it's going to allow the bones or the vertebrae to go back into place. So right now there's some curvature, they're just doing different things. When we're done with the treatment, it's going to release the whole nervous system, the whole spinal cord, so the vertebrae can go back into its original state, and she'll be free of pain. Okay, that's probably... Are you still taping? Yeah, okay. You can edit, right? Okay, so these points are locally. We're doing a lot right now just because there's a lot of muscle tension. So we did the neck, we did the shoulder, we did the upper back. These next points are going to be for more internal issues. So this is bladder 17. It's good for the blood. She mentioned in her period there's a lot of coagulation or thickening of blood, a lot of cramping. So this point is going to help invigorate blood and move blood. That shakiness in her tongue was the liver that we were talking about, and that's also emotional base. So we're going to do bladder 19, and that's going to help with the liver. Okay, so now we're going to move into the lower back, which is her chief complaint. The right hip is mostly involved, so we're going to start with that. Right now we're going to work on the sacrum. Now from here, we're going to move into that right hip. And oftentimes if you're having a hip issue or you're having a shoulder issue, it's usually the opposite. So if you're having a left shoulder, it's going to be the right hip. Or if you're having like a right knee, oftentimes it could be the left elbow. So this is going to help balance out the hips, which in return will balance out the spinal cord and also the shoulders. Now we're going to move into the lower back. Most of your tension in here?
Mm-hmm.
Okay. What about here?
A little bit, but more where you
More, yeah. So this is definitely hip related. So, why don't you go ahead and just relax your arms out here a little bit. Perfect. This one too. Very good. Okay, so now we've done the local areas, the neck, the thoracic, the upper back, the shoulder, the lower back. We're going to go to the four extremities. So we're going to do stuff for the emotional issues, the heart stuff, the heart. So this is heart 3. It's going to help calm our emotions. And it's going to work really well with bladder 43 up here. And then I'm going to do some distal points for lower back. So bladder 40 is a good point. Oftentimes if you're having low back pain, it's associated with the knees and associated with the ankle. So we'll want to treat that too. And then we're going to do bladder 60. Bladder 60 is good on the lower back, but it's also good for the neck. There's a lot of muscle tension here, so we're doing the acupuncture, which is going to help release that, but it's also really good for the joints. And then we're going to follow up with some cupping to break up the fascia for the muscle tension.